everyone. A very good evening to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us. So, the topic of today's discussion is Heroes Fight for Health. Join the Prostate Cancer Awareness, and this initiative is supported by Zydus Life. Prostate cancer is a significant health concern in India, ranking as one of the most prevalent cancers among men. According to WHO data, prostate cancer accounts for approximately 7.7% of all the cancers in Indian men, with an estimation of 1,05,000 new cases reported this year. Additionally, it is a leading cause of cancer related deaths with around 30,000 fatalities in 2020 alone. These statistics highlight the urgent need for enhanced early detection, prevention, strategies, and treatment options to address the growing impact of prostate cancer in the country. So, in this session, we are going to discuss and highlight the holistic prostate cancer care by integrating physical, emotional, and psychological support. To begin with the discussion, first, I would like you all to join me in welcoming our expert who is going to provide us with insightful information on understanding about the prostate cancer awareness. So, I would like to welcome Dr. Sandip Sarkar, Radiation Oncologist, Ruby Cancer Center, Kolkata. Good evening, Dr. Sandip. Welcome to the discussion.
Good evening. Good evening, all of you.
Yeah. So let's delve into the discussion. So, Dr. Sandeep, to begin with the discussion, first I would like you to please provide us with the information on what does a holistic approach to prostate cancer treatment involve and how it is different from traditional treatment methods.
See, prostate cancer generally we see in the elderly age groups. So the age group we see is more than 55 years. Elderly male, the prostate cancer is more common, and it is and the treatment includes surgery, radiation, and if it is in stage 4 cancer, we give chemotherapy along with the hormonal therapy. So the first of all, if the tumor is small in the only in the prostate, like T1 disease, so our plan is to go for surgery, and sometimes surgery is not feasible for elderly man who has got a lot of comorbidities, heart issues, asthmatic patients, history of COPD and other comorbidities. For them we go for radical radiotherapy along with hormonal therapy. So you can ask me what kind of hormonal therapy we give. So there are two kinds of hormonal therapy. One is surgical castration, another is medical castration. In surgical castration, basically we take out the testes with surgical method that is called orchidectomy. So through that, the complete cessation of the hormones. As a result, the cancer cells basically shrink, and the size of the tumor also become small. So that is one option. If the patient do not want to go for surgical castration, in that cases the patient need to take hormonal therapy monthly or 3 monthly, and that need to be continued. Depends on the risk of the prostate cancer. Suppose there are three different group of prostate cancer. One is the low risk, another is intermediate risk, another is high risk. So depend on that we decide the treatment.
Thank you, Dr. Sandeep, for these insights. So we talk about the therapies. I would like you to please explain us how can providing physical, emotional, and psychological support can improve the patient outcome in prostate cancer management.
So that is most important whenever there is a cancer in a family. So not only the patient, the family, son, the wife, and everyone becomes very stressed out. So in that cases we need to discuss elaborately regarding the treatment, because any cancer the treatment will be very prolonged. It is not a 1 day matter or 2 days matter. So, and the cost and the effectiveness of the treatment, duration of the treatment, so everything will be like for 3 months, 4 months, sometimes it goes for years. So in that cases we discuss the prognosis of the patient. We need to discuss with the family, means whenever we discuss we have the whole family need to be there, so we can talk everything. And and during that the attach means the emotional support for that. Sometimes we send those patients who to our psychologist or to our psychiatric doctors for some medication. Sometimes patient becomes very panic do we have seen many patients with the panic disorders. So for those patients we need some psychological help also regarding this treatment, because the duration of treatment is very prolonged. So support, mental support is very essential for those patients.
Thank you, Dr. Sandeep, for these insights. Moving ahead with the treatment part, what are your views on the multidisciplinary approach for the prostate cancer treatment?
So as I have discussed them, there are three kinds of treatments. I'll rather say four kinds of treatment in prostate cancer. So one part is called surgery, second is radiation and hormones, another is the chemotherapy. So in multidisciplinary team, we all the surgeons, radiation oncologist, medical oncologist, radiologist, pathologist, we all sit together and discuss which treatment will be the best for the patient and which is will be the correct for the patient. So depends on the risk of the disease, like as I mentioned, if there's low risk, then we don't treat the patient at all. So we keep the patient on observation, and sometimes with the hormonal therapies only, without any surgery or without any radiation. So sometimes in prostate cancer you don't need any chemo, any surgery, in any radiation also, if the tumor is in low risk category. So depends on this risk, we multidisciplinary team sits together and decide which will be the correct treatment for the patient. So after the discussion, we proceed for the treatment.
Thank you, Dr. Sandeep. Moving ahead, what do you think that what is the role of patient education in a holistic approach to prostate cancer care and how it can be improved to benefit patients?
So sorry, I just missed your question. Can you repeat once again?
Yeah. So, what is the role of patient education in the holistic approach to prostate cancer care and how it can be improved to benefit patients?
So basically, the whole treatment, whatever the new in stage 4 cancer, there are a lot of um, scientific um, um scientific things are going on, so that new drugs are coming up basically. So with those, like those are like phase 3 trials are pending, many drugs have come. So for that we need to wait so that we can more add more drugs in this kind of treatment.
So, you talked about that there are so many clinical trials are
Yeah.
pending. There is so many research going on. So, I would like you to please tell us, are there any recent studies that shows the benefit of combining physical and psychological therapy in the prostate cancer patient? Or maybe there is any clinical research which actually proves that this particular treatment plan is more beneficial for the patients?
See, the treatment is another part, and psychological support is also important along with the treatment part. So if the patient do not have the psychological support during the treatment, they cannot complete the treatment. So it is very important, uh, support from the family, support from the nearest one, and support from the treating physician himself. So this is most important, but there is no trial on that, as far I know. But yeah, definitely means mental and physical support and is very important to complete the treatment, because it's a prolonged treatment. So it is definitely important.
Thank you, Dr. Sandeep, for the insights on these latest developments. Moving ahead, how important it is nutrition in managing prostate cancer care, and are there any specific dietary recommendation for the patient who are undergoing the treatment you want to give?
Yeah, during this treatment, we always encourage patients to have high protein, high fiber diet, and high calorie diet as well as, because this chemotherapy or cytotoxic agents causes anorexia, means loss of appetite. So we have to improve their appetites, and they need to eat well with at least 1800 kilocalorie to 2000 kilocalorie per day. So we have a specific dietitian to make a diet chart for the patients undergoing the cytotoxic drug therapies along with the radiation. So diet is most important, and we always say uh, to have high fiber, high calorie diets. There should be a lot of fruits in the diet, a lot of protein, animal proteins. Those who don't take animal proteins, there are different for vegetarians also. Tells we the dietitian make the diet charts, and along they need to follow that diet charts.
Thanks, Dr. Sandeep, for this. How do lifestyle changes, such as exercises or maybe involve in some activities, contribute to the holistic management of prostate cancer, and how these can be effectively integrated into their whole treatment plan?
Yeah, during treatment, we don't recommend to do exercises for the patient. But once they finish their treatment, and they we after assessment of we do assessment by imaging with the CT, MRI, and see if there is no disease. They can go back to the normal lifestyle, and with the normal activities. We encourage the patients to have their normal lifestyle. Once they are cured from the cancer, they can go back to their normal activities and can start all kind of exercises, yoga. So, and those are really important. Even cancer prevention, if you look at not only the cancer patients, even if you look at the cancer prevention also, exercise is most important. Diet and exercise, and there are a lot of studies have shown that exercise, basically daily exercise, can reduce the chances of getting cancer. Thank
Thanks, Dr. Sandeep, for this insight. Since you mentioned that you recommend exercises once they are on a cured stage, so what strategies can healthcare professional use to address and manage fear of recurrence and anxiety in prostate cancer survivors?
Sorry, anxiety. I didn't get you. It's-
What strategies can healthcare professional use to address and manage fear of reoccurrence and anxiety in prostate cancer survivors? How we
Okay.
do address that?
Okay, so basically, the chances, like, see, anxiety is very common in all the prostate cancer. It's not only prostate cancer, whatever the other cancer we treat. So for those, we give some medications during the treatment to reduce their anxiety, because sometimes anxiety causes the blood pressures. We cannot high blood pressures, and there are a lot of other diseases, comorbidities, and history of comorbidities can also contribute with this anxiety. So for those patients, we do the counseling. We have another we have psychologists in our department. So we discuss with the patients, we discuss the prognosis, we give more time to those patients, so that they should understand the treatment process correctly. They should understand the type of disease he is having, and there is a and he means we have to make him understand this is prostate cancer is a curable cancer. So he need to understand that, so that if he understand the disease process and the treatment process, I think the anxiety part will be taken care of by this kind of discussion with the patient. So discussion is the most important.
Yeah, very rightly said, Dr. Sandeep. So, moving ahead, can you discuss the current state of prostate cancer awareness in India and what are the key areas where public education is still needed?
Yeah, see, we have in from our hospital. We every year we do prostate cancer awareness, and we try to reach out not only the urban areas. We try to reach out the rural areas where they do not have any ideas regarding this prostate cancer. So how we do that? We basically do in three ways. One is the social media, another is like newspaper, and another is the small programs in areas with the placards and all. So we try to reach out people, and we have to tell them, so what are the symptoms of prostate cancer, like any suddenly anyone having difficulty in micturition, difficulty in passing urine, there if there is blood while passing urine, or there is pain. So these are the symptoms, like suddenly there is a urgency in the midnight, person need to go for the micturition again and again, repeated urgency, cannot hold the urine. So these are the symptoms, anyone gets it, like more, and the person's age is more than 50, should come to us and do the cancer screening. And for that cancer screening for prostate cancer is very easy. You just need to check your PSA level, and you will need to do a USG. So through that we can diagnose it.
Thank you, Dr. Sandeep, for these insights, and I think these are really useful for the viewers. Moving ahead, what are some of the most common misconception prostate cancer that you frequently encounter, and how can we address these misunderstandings effectively?
There are misunderstandings of who means can you elaborate means the question
What are
again?
some of the common misconceptions about prostate cancers that you frequently encounter while
Yeah,
dealing with the
we
patients?
encounter is the biopsy. People do not want to do biopsy because people think that if they do biopsy, there is a chance of spreading cancer, but it is a wrong idea completely. If we don't do a biopsy, we can diagnose the cancer first of all. And as we know that early stage prostate cancer is a completely curable cancer, so we, this misunderstanding, we need to come out, and we have to do biopsy to find out the type of cancer so that we can treat the patient. And biopsy never
Thank,
treats cancer. It's a wrong concept.
thank you, Dr. Sandeep, for these insights. In addition to the conventional treatments, are there any complementary therapies that can support prostate cancer care, and how they can be integrated into the uh, overall treatment plan of the patient?
The complementary support for the prostate cancer.
Yes,
Uh,
complementary therapies that can support the prostate cancer care.
yeah, definitely there are complementary supports of with the there are a lot of nutritions, lot of nutritional things they can take, a lot of like antioxidants, exercise, uh, the food habit need to be changed so that there is a there is a chance, means patient may not have any kind of cancer. So it is very important. And during treatment, we always try to tell the patient, try to take healthy foods, and so that it should not, you should not get the cancer again. And uh, and quit the smoking. If someone is smoking, quit alcohol or any kind of like tobacco kind of you and chewing tobacco. So these are the things patient need to understand.
Thank you, Dr. Sandeep, for these insights. Moving ahead, what role do the patient advocacy group play in improving the quality of care for prostate cancer patient, and how can individual get involved into these organizations?
Okay. There are different organizations where can you repeat again? Sorry, I just your voice toppled. Sorry.
Yes, sure.
Yeah.
So, what role do patient advocacy group play in improving the quality of care for prostate cancer patient, and how can individuals get involved into these organizations to get the proper treatment plan?
Okay, so I actually I do not have any idea about these groups, but we have, there are a lot of NGOs, so who can help that. But I actually do not know about this, how they can get it. But in government medical colleges and government sectors, maybe there are a lot of NGOs where they can get attached and they can get the free treatment.
Thank you, Dr. Sandeep, for telling us. Moving ahead, what specific physical therapies or interventions have proven effective in supporting standard prostate cancer treatment these days?
Physical therapy do not have much role actually because there is no data on that. But a lot of physical therapies are going on because after surgery, prostate surgery, some people need some physical therapies to improve the quality of life, and some exercises are there to and physiotherapies are there to improve their. Basically, those are like um, um, to basically to get back to their normal life, because many people after surgery can have difficulty in passing urine. Some people may have erection disorders, so for those patients may sometimes help with the physical therapies from, but from our side, like I am a clinical oncologist from chemo or radiation, so in that cases we don't recommend people for physical therapies, but it is definitely good if they can get it.
Sure, Dr. Sandeep. So we talked about the physical therapies. In your view, how can healthcare provider better recognize and address the psychological impact of a prostate cancer diagnosis, and how a healthcare provider can calm down a patient in order to get understanding of the disease better, and to understand the make the patient understand that this is going to be the treatment plan and how it is going to be treated.
Okay, so psychological therapies and physical therapies are different, completely different kind, um, different kind of therapy, which basically we decide whom to go. We don't send each and every patient for to our physical and psychological department. So those patients who are really depressed during the treatment, and sometimes some patients have a mind set up not to get chemo, not to get radiation, because there and death fear also importance. There is many patients have got a death fear also. So for those we recommend this kind of therapies, and I personally found it's very important to get these therapies for those patients who have these issues, and 90 to 95% cases we have found that these are beneficial for those patients.
Thank you, Dr. Sandeep, for these insights. So, moving ahead, can you provide us with an example of a successful integrative care model for the prostate cancer patients that include various form of support and that actually help them to get the better treatment?
Okay. So basically, success. There are a lot of places where these treatments are going on. So, um, like I have mentioned, you sorry, you want to know which places, right?
Yeah, any success story which actually help patient emotionally, physically, or psychologically to get the better treatment and in their ongoing prostate cancer journey.
So, see, in prostate cancer, there are uh, lot of we have lot of patients who have completely cured, because we always say the people, if you have get the prostate cancer any stage, it is curable. Even many patients who has got a bone metastasis, we still treat the prostate cancer as a oligomets is a curable cancer. So nothing, and I personally treated more than 1,000 cases of prostate cancers, and out of those, there are 70% patients that's completely cured. So 30% have died because of some comorbidities. So chances of cancer death due to cancer are very less in prostate cancer, and there are and I do not know about the prostate cancer, but there are a lot of other cancers. Many people have come out, and yeah, there are a lot of success stories. Even this there are a lot of celebrities, a lot of cricketers, their hero actors who have come out from the cancer after completion of their treatment. So we always try to um, um, try to tell people, see, this cancer is not the end of life, so there are always a chance that you can come out completely from the cancer. So, and at least most important is the discussion. If you discuss with the people correct way, they understand, and so that we can continue the treatment because it's a prolonged treatment, so we need repeated discussion with the people, and so that they can continue the treatment without much fear, without much mental issues.
Very rightly said, Dr. Sandeep. I think communication is the key, which actually enhance and improve the whole treatment process. So, in the end, to conclude, what message you want to deliver to the people who are suffering from prostate cancer, maybe diagnosed very early or at the risk of this disease?
uh, my uh, my message to all my viewers that see, prostate cancer is in early stage is 100% curable cancer. So diagnosis is the of treatment. So if you do not come to us with your problems, we cannot find out the solution. So any issues like if your difficulty in passing urine, if there is a pain while passing urine, or any kind of bleeding during while passing urine, you should come to your nearest doctor to get at least a ultrasound done and see your prostate, how is size of the prostate, and if there is any tumor, please go and get a biopsy done. And if we can find out it in early stage, it is curable. But if you don't find out in early stage, then the treatment will be prolonged. There will be multiple kind of therapies like surgery, radiation, chemo. And if we find it in early stage, the cost of treatment will be very high. So please come to us and get a biopsy done, and if we can find out in early stage, then the treatment will be prolonged. And if we can find out in early stage, then the treatment will be prolonged. And if we can find out in early stage, then the treatment will be prolonged. And
I think due to some technical difficulties, Dr. Sandeep is not able to rejoin. Thank you everyone for joining us with this session. Thank you so much.